Gutierrez here, physical therapist. You can find me at movementthinker.org. Today we're going to cover a hip hinge. This is an important movement, right? It's described by Stuart McGill in the shortstop squat that he describes in some of his papers. In the clinic, give you a little bit of background on myself. First, I am a former powerlifter, placed first in state many, many years ago. Former strongman, placed second in state many, many years ago. I'm aging myself now. That's all right. But the hip hinge is a very important movement in sports and in life. You know, we're all athletes. It's just to what extent. So the hip hinge is very important. One of the things that happens is I'll typically ask my patients to show me a squat. Many patients say, I'm not squatting because it hurts my knees. That's a very common thing to hear. And inevitably, I'll always work back to, okay, show me your squat, right? They're trying their best to get out of it, and I just need to see it, right? I don't care about adding weight. I need to see how they move, and that's usually how I'll explain it. I just need to see what happens to your body when you try to move it in space, because if you can't move it in space well, then I'm probably not going to ask you to add more weight to it, okay? So here we go. I had a patient recently who I asked to squat. This is the reason why I'm making all of these videos, because the patient is visual and needs to see things. And so I'm making these videos for these patients. First, I asked this patient to show me a squat, and I'm getting a smile and I'm shaking my head because I don't even want to do it, because it hurts me to even think about doing this, you know? Again, real quick, I got to go back and tell some stories here. So I've squatted well over 500 pounds. But I have probably squatted over thousands of repetitions in my career in powerlifting, and that technique is just grained into my head. You know, I can easily just drop. I don't even have to think about it. It's just the technique that I drop into. And so when I have to do a squat like other people would do it, it's hard for me to even imitate because my brain doesn't even want to go there. That's called motor control, right? Perfect practice makes perfect over the course of time. And if you practice a specific technique, it's hard to unlearn that. I think the last thing I saw was it could be up to 60 days to unlearn a pattern. Here's the pattern. I'm procrastinating because I don't want to do it, okay? But here's the pattern that I typically see, and it's almost like a catcher's crouch. I caught for a long time in baseball, and again, procrastinating, right? So all right, let me just get it over with. So I asked patients to squat, and this is the first thing that they show me, and they say, oh, that really hurts my knees. And inevitably, I always say, well, that hurts my knees too, watching you. So let's please stop doing that. I always shake my head when I see that because no. And so for these patients, there's two ways to learn, right? You have part to whole, hold apart, right? I can try to teach you the whole motion and see if you can pick it up, or I can break it down into its pieces and see if you can pick it up. Very few patients can I say, all right, here's what we're going to do. We're going to drop the butt back. We're going to lower the hips down. You know, keep your head up, chest up, and then stand back up with the weight over the middle of your heels. There are a ton of directions that go into teaching somebody how to squat. And so I don't tend to do it that way, especially if you don't have a background in athletics, powerlifting, strongman, or any sort of strength sport. So what I will teach is called the hip hinge. I really like the way Dan John teaches it. Dan John, strength coach, former Olympian, college coach. I really like Dan John. I'm biased, obviously. Was a strength athlete. I don't want to say am anymore because I'm far removed. But I was a strength athlete. But for my patients, I don't tend to teach it like that. I teach it against the wall. Okay? And what I'll do is I'll tell them to put one foot against the wall, take another foot out, and so they're essentially 1 foot length away from the wall. And then I'll have them keep their chest up, head up, slide back, touch their butt to the wall, and stand back up. Can you come and take that from the side? And so again, head up, chest up. You'll see how much the pelvis will move. The pelvis is actually going to translate backwards like this. One of the other things that you'll notice is that my shins will stay relatively vertical, and they might even go behind vertical slightly when I do this. My arms will go forward to counterbalance, right? And as you learn this motion, you may not need to use your arms to counterbalance anymore. You go back and you lightly touch, and then you return back up. What we're trying to avoid is a lot of this motion when we do it. And so the goal becomes to try to stay as tight as possible through there as you drop back and touch, and then return back up. Many patients can't do this, and that surprises me, right? So many patients can't do this because for me, this is a motion I grew up doing. You know, I grew up from the age of 20 through probably 32 as a power lifter and competing. And so it surprises me that people they've lost the ability to do this motion. And so for some patients, instead of taking a full foot away, we take a half a foot away. And just teach them how to move their pelvis, right? Teach them how to lean forward and lean backwards. One of the things that I cover is and this only works for certain populations, right? I mean, if you're under the age of 20, you might not know this. If you're over the age of 70, you might not know this. But in the intro to The Simpsons, there's that bird that has a little water on the bottom, you know, and you tap it, and it just goes. Anyway, the bird never bends, right? And so one of the things that we're trying to avoid here is using spinal motion to create a hip hinge. The goal is just to teach how to hinge at the hips, how to move through the hips in order to create the initial portion of a squat. Once they can get that and can get a full foot length away here, once they understand the hip hinge, then from here we can progress down into a squat. But I try to unlearn that knee move first and then hips move second, and try to teach hips move first, knee move second. Once they understand that, then, in doing so, moving the hips first instead of the knees, you're unloading the knees. There's research on that for ACLs that show that if you create a hip strategy, you're going to load up your glutes, your lumbar spine muscles. You're going to take the load off of the knees. So when patients say, my knees hurt when I squat, no, your knees hurt when you squat like you squat. So let's try to change that and see if that changes your pain. It's not really treating anything, it's just loading things differently. So again, hip hinge is a very important movement in order for you to be able to transition to any other movements, such as getting up and down from a chair, picking something up from the floor. Oh, and since I'm here, again, stories are coming out. Since I'm here, I see all of these pictures, right, that are the proper way to lift. And you see people go into this catcher's crouch, and then they grab a box and pick it up. First off, blows my mind. Second, I challenge you to find me any power lifter that picks up heavy weight in that fashion. And this is where we can actually use that population, those power lifters, Olympic lifters, strongmen, because when they're doing it at the top end, that's something we can learn from in order for us to do stuff during our everyday lives. So again, the hip hinge, literally, slide your pelvis back and return back up, is the first motion to be able to pick stuff up, and could be the first motion to sit. You can sit with your knees forward, that's fine. But just know that you're building a different plan when you do that, a different brain plan, a different motor plan, a different habit. Move well, live well. Thanks for watching.